Hello and welcome to this special edition of Cronkite News. I'm Holly Bernstein and thanks for joining us. Cronkite News is committed to bringing you reports on the consumer beat. And tonight we look at some of our top stories on protecting the health and livelihoods of Arizonans statewide.
There's a new treatment for rattlesnake bites being developed here in Arizona. I traveled to Tucson to meet with the developer to learn how it can help fight the snake's venom more quickly. Arizona is home to 13 types of venomous rattlesnakes. Bites can affect your heart, nervous system, tissue, and blood coagulation. And the sooner you get treatment, the better.
Right now, the most promising thing that we're working with is the use of what are called carbon monoxide releasing molecules that seem to inactivate venom molecules or venom enzymes specifically.
This new therapy, created at the University of Arizona, could be administered on a hiking trail or in the wilderness, not necessarily in the hospital like anti-venom.
So the way that we see this technology kind of playing out in the market is campers or hikers or people that are outdoors and are exposed to the environment where they may have a rattlesnake or some sort of a snake that they may encounter, that they can have this in their pocket, in their backpack, in their first aid kit, so that if they are bitten and they're not close to a hospital and need that extra time, it functions like an EpiPen that a person can administer on their own.
Dr. Nielsen's latest research has shown that he can stall the effects of venom in rattlesnakes like these for up to an hour.
We found out that we could inhibit venom directly, which is something we didn't know a year and a half ago. The other thing is, when we exposed venom to carbon monoxide and then put it into an animal model, we found that we were able to prevent the venom from doing things to coagulation for about an hour,
leaving enough time to get the victim to the hospital for further treatment. Nielsen has found the therapy works against the venom in more than 36 species of snakes. To advance his research, he needs nearly $500,000 in funding.
It's an alarming trend in strokes. Since 2013, the age of those having strokes is falling. That's according to the Centers for Disease Control. Cronkite News reporter Sierra Delgado talks to Arizona's experts about how to reverse this trend.
Mike Murtha was 48 years old when he had a stroke that left him with a paralyzed right side and other problems.
I had a tracheotomy and a feeding tube, so it was fed through basically a bag through a tube into my body. I couldn't speak at that point. Couldn't move the arm or the leg.
Another Valley resident woke up in the middle of the night at age 50. Something was wrong.
My blood pressure went up to 225 over 193 that night. Constantly go to the doctor, and if you have high blood pressure, make sure you take your pills. Because I didn't know I had high blood pressure.
Risk factors like high blood pressure, smoking, and hypertension are what is now helping increase strokes in people who are younger than the usual stroke patient.
In the last decade or more, one trend that's starting to emerge is that in people under the age of 65, their risk factors are going up, not down. So we're seeing more hypertension, more diabetes, more obesity, and more people with multiple combinations of those risk factors.
The Centers for Disease Control says Arizona is one of 21 states and the District of Columbia where stroke deaths have increased since 2013. According to Dr. Jeremy Payne, it is hard to get younger people to start addressing the potential risk factors.
You have a conversation with a young person, say, about smoking. Realistically, that conversation may not pay off for 20 or 30 years. It's really difficult to get people's heads around the idea that behaviors now may not pay off until you're much older, but when they do pay off, they pay off in ways that we can directly measure.
I still can't live on my own. I can't take care of myself, can't put shoes and socks on, so it's very frustrating. I can't work a normal job at this point. I'm hopeful that I will be able to eventually, but as I said, recovery is a very, very slow. Even if it's steady, it's still a very slow process.
Dr. Payne advises to get your blood pressure checked regularly, exercise, and eat nutritiously to help lower your risk factors. In Phoenix, Sierra Delgado, Cronkite News.
Think FAST to help detect a stroke. Look for face drooping, arm weakness, and speech difficulty. If you notice these signs, it's time to call 911 immediately.
The fight against HIV and AIDS in Arizona is taking on its biggest opponent, secrecy. Cronkite News reporter Tatum Hubble shows us how a new campaign aims to stop the spread by stopping the stigma.
Experts say new HIV cases in Arizona are rising, even as they decline in other states. One reason for that is people aren't sharing their status.
I just heard that somebody I'd been dating had it and had not been truthful with me, so I went and got tested with a good friend of mine, and the test results came back positive.
Arizona is currently ranked 15th in the U.S. for newly diagnosed AIDS and HIV cases. The city of Phoenix is taking a stand and setting a goal to end this epidemic for good. Phoenix has launched the 90-90-90 plan in hopes to end the spread of HIV and AIDS in Arizona by 2030.
It has benchmark goals of 90-90-90, which is trying to get 90% of people in Arizona who are HIV positive tested and identified. Also to have 90% of those individuals who have tested HIV positive in treatment and on antiretrovirals so that they can live a healthy life. And then finally, for those persons who are in treatment, to have 90% of them having achieved an undetectable viral load. And that means, now we know, that undetectable means untransmittable.
Experts stress the importance of starting conversations and educating the public about HIV and AIDS.
I went through some severe depression with it. It affected my daily life where I didn't want to get out of bed, I didn't want to leave the house. It was really rough, but as you cope with it and you seek counseling and things like that, it becomes better.
Olson is thankful his HIV has not developed into AIDS and his viral levels are undetectable. In Phoenix, Tatum Hubble, Cronkite News.
The foundation plans to provide more education through a community coalition, pursuing grant funding and working with pharmacies.
It's back to school time, and many teens in Arizona are keeping up with their shot records, including the HPV vaccine. Cronkite News reporter Sierra Delgado shows us why more Arizona teens are getting shots to prevent sexually transmitted diseases.
Human papillomavirus is a virus that can cause certain cancers and diseases to both girls and boys. For Sandra Cañez, getting her kids vaccinated was worth it.
I think it's good to kind of take those blinders off. Be proactive and come to the realization that, again, children are going to be children, teens are going to be teens, and they're going to do what they want to do at times. And if we can just try and help to prevent them from causing any type of harm to themselves, then might as well do it.
Schools in Arizona don't require the HPV vaccine, but according to the Arizona Department of Public Health, 68% of girls and 51% of boys have gotten at least one dose of the vaccine in 2015. Maricopa County nurse Linda Watson explains what happens if a teen does miss a dose.
The problem is that they're not going to be totally protected. But the good news is that even if you get a dose and you don't go back for 2 years, you can get the next dose, and it's still effective.
And Dr. Shafiq Tomei wants parents to know that simply getting their child vaccinated can save the family from regrets.
This is a vaccine that prevents cancer. And so why wouldn't you give that when it's a simple shot versus a lifetime of problems with cancer treatment afterward?
Cañez recommends parents educate themselves about the HPV vaccine.
The cancers that are going around and how common it is nowadays, the STDs, how common those are as well. Anything that we can do to prevent our kids from, contracting one of those, whether it be now or in the future.
Experts say that parents should worry less about the vaccine being a sex-related issue and more of a cancer prevention issue. In Phoenix, Sierra Delgado, Cronkite News.
The CDC recommends kids ages 9 to 12 years old receive 2 doses of the vaccine, and teens 15 and older receive 3 doses.
President Donald Trump declaring a national public health emergency to combat the opioid epidemic that claims more than 100 lives a day.
Beyond the shocking death toll, the terrible measure of the opioid crisis includes the families ripped apart and, for many communities, a generation of lost potential and opportunity.
Overdose deaths involving prescription opioids have quadrupled since 1999. Today's emergency declaration means states and federal agencies will have access to more resources to fight the epidemic. Reporter Monica Sampson is looking into how those resources will impact Arizona.
Governor Doug Ducey declared a statewide health emergency for Arizona because of the opioid crisis back in June. Cronkite News spoke with those on the front lines fighting the epidemic, and they say President Trump's actions today doesn't go far enough.
In Arizona itself, we have about 2 people a day that are dying from opioid-related overdoses, which is a pretty significant tragedy.
This public health emergency doesn't go as far as a national emergency declaration would have. While it encourages different agencies to work together, it doesn't automatically provide funding to fight the crisis. Congress has to take action to provide more funding. Toxicologist Dan Kwan of Maricopa Integrated Health says while we wait for lawmakers, more people could be at risk.
Opioid addiction or opioid use, let's say, and even in someone who's never taken opiates is death.
Dr. Brazzi says the most important step in fighting the opioid epidemic going forward is open conversations, saying we need an integrated approach to medicine like therapy and group counseling.
I think, continuing to get the word out is critical, and so I think that was an important first step today, the announcement. I think also, ultimately, treatment for this does cost money, and it would be great for the government to really look at making sure that there's appropriate funding for people to receive MAT services, which stands for medication-assisted treatment.
Also a concern, the amount of heroin and deadly fentanyl still coming into our state.
So I think we're seeing a great deal of the fentanyl product, which is kind of an emerging issue for us. Started off with the opioid issue with the prescription opioids, then we switched over to heroin, but what we're seeing right now is a lot of the fentanyl product that's coming in, specifically in the pill form, to meet that burgeoning need for opioids amongst our addict population here in the United States.
One way to help reduce the use of opioids is to get rid of unused prescriptions you have at your home. This Saturday is the National Prescription Drug Take Back Day, and there will be more than 40 drop-off locations around the state. In the Broadcast Center, Monica Sampson, Cronkite News.
September is National Recovery Month, and opioid abuse is at an all-time high, but addiction can be overcome. Cronkite News reporter Sierra Delgado looks into why it has become such an issue.
This past summer, Governor Doug Ducey declared a state of emergency because of the opioid epidemic in our state. Deaths from prescription drug-related overdoses has been on the rise for the past decade. Someone who understands how opioids can become addictive is Austin Eubanks.
I was one of the injured survivors of the Columbine shooting that happened April 20th, 1999. And by way of that, I was prescribed opiates. At that point, I had never smoked weed. I had never drank a beer. I was 17 years old. And within a matter of weeks, I was in active addiction without even knowing what was happening.
According to the CDC, opioids have killed more than 33,000 people in 2015, which is more than any other year. And in Arizona, at least 2 people a day die from opioids. Stephanie Siete explains that although there are antidotes like Narcan available to reverse these overdoses, the drugs can still be too powerful.
With something like fentanyl, and a lot of these drugs are unknown and undetected at the time of the overdose, it can take 2, 3, 4, 5. You just don't know hits of Narcan, and does the first responder have enough? So it's helping save lives, but it won't save everybody.
There are outlets like recovery centers that can help address this addiction, like Crossroads.
People such as myself who have gone through the program and now work for it have a vested interest. We truly believe in this program, and it saved my life, so I truly believe that it can help somebody else.
Eubanks believes that education about this crisis can help others know the effects.
Talking about the way that opiates affect emotional pain is incredibly important, because I believe if I would have had the knowledge to actually know that I was medicating emotional pain, I would have been able to stop it earlier on.
Not dealing with emotional issues can be a trigger for relapse. According to the National Institute on Drug Abuse, the relapse rate for drug addiction is 40 to 60%. In Phoenix, Sierra Delgado, Cronkite News.
Cronkite News is dedicated to covering the opioid crisis. Our documentary Hooked RX From Prescription to Addiction highlights the problem of painkillers in Arizona. Find resources for getting help online at hookedrx.org.
Valley fever is a well-known disease in Arizona that can affect the organs, tissue, and respiratory system of humans and animals. There's currently no way to prevent it or cure valley fever. I went to Tucson to learn what the U of A Valley Fever Center for Excellence is doing to fight this disease. Respiratory problems, fatigue, joint aches and pain, those are all symptoms of a disease called valley fever.
It's a fungus which, when things get dry, small single cells of the fungus float off into the air, and if you inhale one of those spores, that's how an infection starts.
According to the Centers for Disease Control and Prevention, Arizona had more than 7,000 reported cases of valley fever in 2015. Now that's compared to the 11,000 that were reported in the U.S. That's more than 50% of valley fever cases just here in Arizona. The University of Arizona's Valley Fever Center for Excellence received a $4.8 million grant last month from the National Institutes of Health to manufacture a live vaccine that protects dogs from valley fever. Camille Kirshner's dog passed away from valley fever, and she hopes this vaccine is successful.
If you can prevent it from happening, then that's a good thing, because you know, sometimes it can be really expensive.
And depending on the size of the dog, treatment can cost $25 to several $100s a month.
Making the vaccine available for dogs is tactically a really good idea. They need it, and we could help them. And if we were to show that the vaccine was safe and effective in dogs, it would make the case that much stronger to then take on a vaccine for humans.
Dr. Galgiani says approval from the FDA for a live vaccine is challenging.
Because it's such a small problem relative to a worldwide problem, I think the FDA would be very slow to agree to licensing for humans.
Dr. Galgiani's goal is to get the vaccine to market in the next 4 to 5 years to help dogs, and then to create a vaccine for humans as well.
New brain injury technology could save you a trip to the emergency room. Cronkite News reporter Tatum Hubble visited an urgent care center to find out how this device is being used.
BrainScope 1 is a non-invasive new technology that assesses traumatic brain injury. One athlete says the device could be especially useful in sports that carry the risk of head injuries.
This new technology would definitely be a lot more helpful for us, being able to get in and get seen quicker with the urgent care physicians, lowering costs. A lot of MMA fighters that are just starting out don't really have the money to put in for a CAT scan, so a lot of these injuries go untreated.
Mixed martial arts and boxing are sports that require little to no protective headgear.
Traumatic brain injury contributes to a substantial amount of deaths and disabilities each year. Contact sports increase that risk even more.
The device is attached to the patient's head and scans for potential brain bleeds or concussions in under an hour, and can lead to earlier treatment.
BrainScope 1 is basically a device that assesses patients that have come in with any type of head trauma. And it really does, it looks at the severity of a potential traumatic brain injury that they've had.
A Banner spokesman said the device saves time and money because patients don't have to go to the emergency room. In Phoenix, Tatum Hubble, Cronkite News.
BrainScope 1 was developed with grant money from the NFL and in collaboration with the U.S. Department of Defense. And it's available at select Banner urgent care centers.
Would you say your last visit to Sky Harbor International Airport was satisfying? According to a new survey, more travelers are saying yes. Cronkite News reporter Inkirka Marinier takes a look at what else is taking off at Sky Harbor.
Phoenix Sky Harbor International Airport has spent millions of dollars improving, and the changes are paying off.
Last year's J.D. Power Associates study, we were ranked 14th, and this year we are tied for 3rd place.
The satisfaction study surveyed almost 35,000 North American domestic travelers. Sky Harbor tied with McCarran International Airport in Nevada. Orlando was first, and Detroit second. Phoenix's emphasis on creating a happy customer experience is one of the reasons for the jump.
Customer service is one of our top priorities after safety and security.
New changes to the airport, such as interactive directories, new restaurants in retail, and the ability to check wait times for security lines played a big role as well.
Really helpful for more than 80% of our travelers who come through Terminal 4, our busiest, because they can go to any of the 4 security checkpoints. So if they know what the wait time is, they can go to another one if it's less time that they don't have to wait.
City officials approved the multi-million-dollar project because of the strong economic impact the airport has. According to the W.P. Carey School of Business, it puts $12 billion in the economy annually and supports almost 60,000 jobs. But the renovations didn't cost taxpayers a cent.
The airport's funded through passengers, and basically if you use the airport, you're going to help pay for the airport.
Some of the money spent on tickets, dining, and retail go toward the airport, and flyer Brittany Kupke says the higher costs are worth it, especially when it comes to the self-service ticket kiosk installed last year.
Well, actually, the kiosk is really good because then you don't have to stand in line, which can take a really long time, especially if you're in a hurry.
To make it easier for passengers to get from the terminals to the rental car center, the city is planning to extend the SkyTrain in the near future. In Phoenix and Kirko-Marnier, Cronkite News.
Phoenix City Council has already approved a $950 million plan to fund the SkyTrain extension and is expected to be completed in 2021.
A new study shows that people with heart disease still may be able to enjoy fatty foods. Reporter Mia Atkins tells us how increasing the intake of fats could be good for heart health.
Brooke Hack and her daughter Haley have the same problem, alarmingly high cholesterol, a genetic condition that puts them at risk of heart disease. They carefully watch what they eat so they can lower this risk.
Her modification is going to be a little less than mine was at her age, but it's still one of those things where you don't want your child to have the same struggles.
Both women have completely changed their diets to reduce fats, but a new study shows that may have been the wrong move. The European Society of Cardiology's results, published in The Lancet, states a moderate intake of all fats was related to a low risk of deaths from cardiovascular disease.
It will change the future of recommending a more moderate amount of fat in your intake.
16-year-old Haley Hack said the study gives her a new chance to be healthier without sacrificing food that tastes good.
I think that, it's just another addition to it, so I guess it's just a couple other things you have to take out of your diet and some things you have to add back in, but I don't know, it'll be different to try.
Brooke Hack was diagnosed with heart problems at age 14 and is optimistic about the freedoms she could gain through this new diet.
It's interesting. Increased fats, which is one of those things that since I was diagnosed, keep your fats super low, keep your fats super low, keep your fats super low.
Dr. Jamal said that many of his patients are shocked when they have to change their diet, and this new study could make it easier.
So we'll be more relaxed for the patient, and we still recommend about 375 to 500 grams of fruit and vegetable in your diet.
About 35% of a person's energy and daily calories should come from fat, according to this study.
The study also states that to stay heart healthy, no more than 60 calories per day should come from carbohydrates. That's about a fourth of a bagel.
Does your teen want a tattoo? Well, there's a new study from the American Academy of Pediatrics that may back up your concerns. Reporter Mia Atkins found out some of the risks young people may face by modifying their bodies.
The study found that among high school students surveyed, 10% had tattoos, and 55% were interested in getting one. On average, teens with tattoos got them around 9th grade, but the sample did show that some were tattooed as early as 8 years old.
I have tattoos that I've gotten from when I was 17, 18 years old, and I regret them every day.
Mikey Surratt, owner and artist at High Noon Tattoo in Phoenix, believes people should wait to modify their bodies until age 18. Dr. Vinny Chulani at Phoenix Children's Hospital says that there are some serious health risks that come along with tattooing, such as infections.
Some of the risks, for example, include irritation and inflammation, and that comes as a result of either a reaction to the pigment or to anything that might have been added to a pigment.
New tattoos require up to 2 weeks of proper care for it to heal. That's a big responsibility for an adolescent.
I don't think there's a mental capacity there to really, truly take that on.
The study advises pediatricians to help their patients understand the commitment they are making when they modify their body.
While removal happens and while removal exists, research shows that young people probably overestimate how easy or how effective removal is. Removal is costly, removal is difficult, and removal is only partially effective.
In Arizona, minors are able to get a tattoo if they have parental consent and the parent is with them when they get the tattoo. But Surratt will not allow anyone under 18 to be tattooed in his business.
And it's just sad because they don't know any better. I think that's the biggest issue, is they don't know any better.
Dr. Chulani has 3 pieces of advice for anyone considering getting a tattoo. Make sure you go to a licensed tattoo parlor with sanitary procedures to minimize risk of infection. Understand the care a tattoo requires to heal properly. Finally, understand that removing a tattoo is not easy and does not work completely. In the broadcast center, Mia Atkins, Cronkite News.
It's like a Victoria's Secret for breast cancer survivors, and it's right here in the Valley. And Kirika Omernia takes us to a boutique that helps these women regain their beauty as they fight the disease.
I learned that it's okay to have no eyebrows, no eyelashes, and bald head and go in public.
Carolyn Morris is one of many breast cancer survivors at an annual breast cancer risk and prevention event at the Virginia G. Piper Cancer Center in Scottsdale. She is a customer of Tina's Treasures, a boutique inside the cancer center that offers products specifically for breast cancer patients.
Mastectomy bras, breast prosthesis, skin care, and wigs.
Although there are functional items sold in the boutique, Supervisor Leanne Porter says the purpose of the store goes far beyond that.
It's important because women's image means a lot. Whether you agree with that statement or not, it does. And for women to feel whole again and feel pretty, this kind of boutique is something that is necessary.
Morris came to the store after her diagnosis more than 2 years ago.
I had surgery in October of 2015. I had a mastectomy.
According to research by the Agency for Healthcare Research and Quality, the number of women who got a mastectomy increased by 36% from 2005 to 2013.
Women just have that misconception that if you remove more tissue, you're going to do better.
Dr. Linda Liu wants women to know that advanced technology now allows for less invasive solutions.
Ladies will live just as long if they have a small tumor, if they do a minimal surgery called a lumpectomy, do a little bit of radiation, as opposed to doing a mastectomy.
While it may not be for everyone, Morris has her mastectomy to thank for being completely cancer-free. In Scottsdale and Kirika Omernia, Cronkite News.
Morris found her lump performing a self-exam and recommends that women do a self-check monthly. Thanks for joining us for this special edition of Cronkite News. For more multimedia coverage, go to cronkitenews.azpbs.org and click on the Consumer tab.